Welcome to the Fab Eye Care Show. This is our first edition. We have a very exciting show for you. I'm your host, Dr. John Fabriziani. I have a very special guest today, Dr. Barry Fabriziani, and today we're going to talk about macular degeneration. Before we get to that, I'm going to introduce Dr. Fab, as many of you may know or will get to know, and we'll get to know him and his practicing style. We'll start from there. How you doing, Dr. Fab?
I'm well.
So, this all started 1986. You graduated, and where'd you graduate from?
So I graduated from Pennsylvania College of Optometry in '86. Yep, and I started out here this practice with Dr. Minio in the fall of '86.
Okay. So for all of you know who may not know, Pennsylvania College of Optometry is one of 20 eye doctor schools in the country, and typically is ranked in the top 3 every year. Yep. So we're very proud of that. I'm also a PCO alum, and we love to bring the best and latest cutting edge technology that PCO really grounded us with. So you graduated from PCO, you did a residence there in ocular disease. How did that kind of set the foundation for who you are today?
So when I first was in my residency, I knew that I wanted to practice more toward disease and high-level care, more medical type eye care. And when I graduated, Dr. Minio at the time had a big ophthalmological practice here in Phoenixville. He was one of the top surgeons in the area, and he was looking to add primary care. So he was interviewing residents, and I was one of those residents, and he hired me.
So you came to Phoenixville, Pennsylvania?
Came to Phoenixville, Pennsylvania in 1986.
So when you first got here, how did the patients approach you, and how did you fit into Dr. Minio's practice?
A lot like you. I was very young looking, and it takes time for patients to get to know you and trust you. And once you get a relationship with patients and they see that your knowledge is there and that you're able to provide the care that they want, everything in life is about results. I mean, let's face it, when you get good results and you give good care, everything else falls into place. And one of the things I tell you all the time, forget about the money, forget about everything. Do a good job and your practice will grow. And that's how we've grown this practice. Before social media, before all this stuff, it was word of mouth in the community. We built a reputation on results and neighbors telling neighbors.
So one thing that Dr. Fab likes to say is take care of your patients and your patients will take care of you.
Correct.
So Dr. Minio retires, you take over for Dr. Minio, and you meet Dr. James Lewis, who is a cataract surgeon here. Yes, Tell me a little bit about him.
We actually recruited him. There were a number of surgeons in the area, but again, we tried to get the best through, well, not only in terms of surgical skills, but in terms of working relationship. And Dr. Lewis fit the bill. He was the chief of the corneal and cataract division at Hahnemann Hospital. He was looking to get out of academia and come out into the clinical world, and we were able to snag him. And it's been nothing but tremendous results from there. And again, getting great results, great surgery, and cutting edge. He's just absolutely cutting edge. He's the top surgeon in the state of Pennsylvania right now.
So you guys will notice the theme of this office: technology, 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 and that's what we're going to talk about today with macular degeneration. 1996 Optometrist of the Year, 2023 Optometrist of the Year for the Philly suburbs. Congratulations to you. It just takes a testament to your hard work. I don't know if you want to say a couple things to the patients out there that put you that award.
Yeah, that's the only way you win those awards is through the patients and their appreciation, because it takes effort. I mean, a lot of times we all get surveys and this and that, and you know, who has time for that? My patients took the time to make sure that I was recognized, and you know, that just warms my heart. It's a lot of hard work and years of relationships with numerous patients. You know, I start with them when they're young, and some of them, you know, we walk to their grave, and it's just, it's family.
It's family. All right, so before we get into the nitty-gritty of macular degeneration, you're a big wine drinker. I want people to get to know Dr. Fab. What is your favorite type of red wine?
Got to go with the Amarones. The Italian.
He likes the Italian.
Unfortunately, I have a bad habit. I'm a collector, and I love very high-end wine, and I love
So
to
all
collect
those
it.
wine drinkers out there, if you make an appointment with Dr. Fab, you guys can have a wine discussion and go through your favorite wines.
Yep.
So we're going to take a short break. We're going to talk about our technology here with macular degeneration. We'll see you on the other side. Welcome back to the break. This is the Fab Eye Care Show with Dr. Fab here, and we're going to talk a little bit more about macular degeneration. But before we do that, just want to remind folks, we are right behind the Phoenixville Hospital, Fab Eye Care on Griffin Street. Lots of parking, an easily accessible and handicapped location. And so we are going to talk about the retina and macular degeneration. So one of the big things that we tell our patients is preventative screening is huge in eye care because a lot of eye diseases occur before you notice a change. So why don't you tell the patients, first of all, what is macular degeneration and how can it affect the eye?
So macular degeneration is a disease of the eye that is usually related to maturity in our patients, but not always, but generally. It's a deterioration of the retina, the back of the eye. And as we progress through life, these deteriorations become more prevalent and more disastrous in the terms of the visual outcome. Nowadays, back when I started in '86, we didn't have a whole lot we could do to prevent it. And we diagnosed it a lot later than we do nowadays. But most of the issue with degeneration is exactly, it's same as in its name, it's degenerative.
So we know that the macula is responsible for your central vision. So tell us some of these signs a patient may have that they're starting to notice these early macular changes for macular degeneration.
Usually it's the reading, it's the close-up, it's your central vision, and usually the reading vision is the first where you start to notice the distortion. And nowadays we hope we would catch it long before you start to have symptoms. It's like anything else in life. When you start to have symptoms, you're a little late to the game. And that's why preventative eye care, being proactive instead of reactive, and we have the technology now to really intervene early and do something about it, where we didn't have that in the past.
So in the past, we would look at your eye and look at the surface of the retina. Macular degeneration works on the retinal pigment epithelium, which is actually underneath what we can see. So it's the last layer of the macula. The macula has 6 layers. So, Dr. Fabriziani, you invested in the technology OCT about 15 years ago, and that allows you to see all 6 layers of the retina. So why don't you talk about how that's helped us in early detection and to catching these patients earlier for treatment?
So in the past, we were able to see the surface of the retina, take pictures, and that was great. We thought we were really doing something with that. But you had to actually see presence of the disease. It had to already be taking place. Now, 15 years ago, with the invention of the OCT, we can use ultrasound, so we start to see changes in the retina, underneath the retina, long before it comes to the surface. So again, catching the disease earlier in the process, and that was even 15 years ago. Now, as we know today, we have even more technology to catch it even.
Well, we're going to talk about that. So how come you've invested so much in the technology here? I mean, we have the OCT, the fundus photo, the dark adaptation, the anterior segment OCT. I mean, we really do have university level technology here, and you've invested a lot in this practice. Why don't you tell the patients the advantages of having that technology versus when you didn't?
Yeah, the technology, the thing that convinced me of all this is they did a study when the new camera came out, and the study came out, they took 500 patients, put them through 15 retina specialists, not general eye doctors like us, retina specialists, they do that all day long. And then they took the same 500 patients, took pictures of them. All 15 retina specialists missed things that the camera didn't. So technology, you can be the best doctor in the world. You can almost be the worst doctor in the world. You have to have the technology. If you have the technology and know how to interpret it, I sleep good at night, my patients sleep good at night because we're getting photographs. We're seeing things that we never saw before. And that makes me feel good that, you know, what I can't see, the machines are seeing. Awesome. So you have to have it.
So we brought in the dark adaptation. And the dark adaptation is for early detection. And a lot of studies came out. And the Alabama study said that people who fail this test are twice as likely to get macular degeneration in 3 years. So we're getting this patient 3 years earlier than we did before and starting to change their lifestyle. Why don't you talk about a little bit what this test does and how it's affected your treatment plans?
So again, it's proactive, not reactive. So this test, the reason we brought this in, macular degeneration, which is dear to my heart, my mother had it very bad, your grandmother. So it runs in family. So you tend to want to be have a little niche toward that because it runs in my family, and I was very interested in it and helping my mother. This new instrument, now we can pick up things earlier before we see any things, before there's any pictures, there's any ultrasounds. It tests cell function, which blows your mind when you think about it.
So what we do is you put this headset on, just like this, and you see a red light, and it flashes a very bright light. And this machine will actually detect how fast your retinal cells recover from that flash. So, Dr. Fab, you're on the beach for 10 hours, you walk into a dark room, and it takes some time to adjust.
For normal people, even.
Yes. So if you're a person who has trouble in dark light or really bright days, and you're saying, oh, it's taking me 6 to 8 minutes to recover, that may be the first warning signs of this macular degeneration. Well, we now can put a specific number to quantify that, and we can classify you into which stage you're in for macular degeneration. So that's really important in how we manage these patients and screening patients who are at risk.
Yep. And the word is early. That's the key word in any disease, in any function.
So there's some risk factors that we know of macular degeneration who especially need this screening. Why don't you tell us a little bit about those risk factors of who should be tested on the early side to pick up these findings?
Well, we know risk factors are, people of maturity, people that are fair-skinned, people that are blue-eyed, people that have the history in their family. But to be honest with you, smokers. We've come to know since we've gotten this instrumentation, everybody's had a risk factor. I've run this test on 50-year-olds, and most of them are normal, and every once in a while you catch a couple that are not normal. Those are the people you're intervening, you're changing their course of their life. We would have never caught them had we not had this instrument. So that's what's, you have to have a good medical eye exam in your life at least once a year, because the screening process, you may have nothing wrong with it, that's wonderful. We don't know who's going to come in that has these, and you can look at them, I look at them all day long, you look good. You put the machine on them and guess what? No, you don't look good. So these are things where, we're going to life change, we're going to be able to intervene. We didn't have intervention years ago. There was no intervention. You just had it and you said, okay, you'll try to hope for the best, but there's nothing you do. Nowadays, tons of things you can do, and there's new stuff even coming.
So in this study that was involved in this, they took 500 patients and they ran this test on everyone, and 100 patients failed the test. Those 100 patients that failed the test that came back in 3 years were twice as likely to have macular degeneration. So we're catching this 3 years earlier. So intervention. What are some things that we're doing nowadays that we didn't do before, changing the lifestyle of the patient so that we can help them avoid macular degeneration?
Well, the ARAD study is the biggest thing. I mean, now we know, we used to think in the past, but now we know for sure there are certain vitamins that slow this down. We know that the Maui Jim sunglasses, which are FDA approved for, protecting you for macular degeneration, is another one. There are, other studies coming out that are going to be beneficial where even in the dry stage, we're going to have medicines now that we can intervene with, interjections we can intervene with, light therapy that we can intervene with. There was nothing before. And so
let's go over quickly a little bit about the vitamins, because I get a question probably about once a day from a patient. Should I be taking eye vitamins from all walks of life? I have young patients, old patients, middle patients. So let's start with someone who has early or no macular degeneration. What vitamin do we recommend?
So the vitamin's kind of interesting because everybody should be on the ARADS vitamin. The problem with that is that the ARADS vitamin has a high level of zinc. And zinc is very beneficial in people who have more advanced macular degeneration. The problem is there was a couple studies that came out that kind of suggested, the high levels of zinc may be associated with some early memory changes and some memory loss. So we don't want to expose those patients unless we have to, because the benefits outweigh the risks. So if someone's in the early stages, you want to give them the ARADS vitamin that does not have the high zinc in it.
So this is new macula omega-3. It's an omega-3 with lutein and zeaxanthin. So it's not the ARADS formula, but it has some of the same ingredients as the ARADS in this vitamin. So if you're out there and you have early macular degeneration or no macular, consult with your doctor. That's crucial, number one. and you can take the new Macula Mega to help with early macular changes to prevent further vision loss.
And not all vitamins are the same. They're not FDA approved, so they're not as regulated. That's why we use the physician recommended vitamin, the vitamins that were in the studies. We try to copy that so that we're getting the proper vitamin that is the right quality and also the right strengths. And so one size does not fit all with that.
And then for people who have intermediate or more advanced disease, we recommend the classic AREDS2 vitamin to take twice daily. And that study really proved its weight. So in that study, 30% of patients who took this vitamin did not progress past the stage that they were at. So that was huge for eye doctors because macular degeneration is the second leading disease of blindness in the United States. So that was really a big study. Maui Jim sunglasses are certified by the American Cancer Society because of their backside UV protection, and they have a 99.9% UV protection. So, you know, when you buy sunglasses that are not 99.9%, you're actually reflecting the sunlight back into your eyes that are dilated. So we've done a really good job of educating our patients on the quality of sunglasses, the vitamins. And I just want to talk a little bit about like kind of some lifestyle changes. So green leafy vegetables are really good. And then exercise and getting your cholesterol in control. Those things all help with prevention.
And
then
controlling
of course,
diabetics. Diabetics are
Yes.
another one that is run. And here's the other thing I just want to interject real quick. You know, it's great to recommend all these things, and we did this for a long time. A patient gets, I can't find them. I don't know where to get them. So we made it very simple. We brought everything here so we can control the quality of the vitamin we're giving. You're giving out recommendation and you're following it up. We have it here.
And
the
we
Maui
have
Gyms, you fought me to, you and I was like, we don't need Maui Gyms. And the minute you told me the studies, we need the Maui Gyms. So
and it's nice that we
them.
have the technology to give us a number. Because some patients, in the studies, they said they weren't even classified in the right type of macular degeneration. So this device with the OCT lets us put you in the right classification with the right vitamin, which best is for your eyes.
And we're very proud of that. I mean, we have a lot of pride here. We want to do things. We got to be the best. We want to be the best. And the only way you do that is you got to work hard. You got to have the right technology, and that's what's important to us. And you feel good at night. You know, when we go home at night, you and I, we're competitive. We want to be the best doctors. We want to do the best job. And when you lay your head on the pillow at night, you feel good about, hey, I did a good job today with my patients. You know, what did I always tell you when you first got to school? Treat it like it's your mom, treat it like it's your dad in that chair, and you'll never make a mistake. And that works.
So you can tell the passion beaming from Dr. Fab's mouth. And we're going to go on a short break, but before we do, I just want to remind folks, we are right behind the Phoenixville Hospital on Griffin Street. Our website is www.fabeyecare.com. There's a lot of information about this and all of other plethora of topics that we deal with every day here at Fab Eye Care. And we'll be right back.
24/7.
Yes, 24/7. We'll be right back. Welcome back to the Fab Eye Care Show. So as you can see, me and Dr. Fab are listening to our own advice. We have the Maui Jim sunglasses on that are certified by the American Skin Foundation. And what they have is the anti-reflective on the back so that it protects you from those harmful rays, and we're really proud to have those in our optics.
They don't look so bad, I mean, either. They're nice. They're pretty cool.
The optics, our patients really recommend the
we
optics.
have a Maui Jim cult.
Yes,
yeah.
he calls it the cult.
The
They
cult.
go back there, and so we're listening to our own advice, and we're behaving. So we talked about kind of the prevention things with treatment. I just want to go over what happens if they need treatment and go over dry versus wet, and then we'll finish up. So, you hear, do I need shots in my eye? Is it dry? Is it wet? I think I get that question 3 times a day as well. So if you want to go over for patients, dry versus wet macular degeneration.
And to start off the top, when you hear shots in your eye, that's got to be the worst thing you could ever hear. It really is not that bad. Patients that go through it all the time, it's not like you can see it coming in. They go from the side, they numb your eye. 99% of the patients don't even realize that it's been done. So, take that off the table right away. It's not as ominous as what people think. I mean, we like to keep you from not getting to that spot, but it's not the end of the world. Hey, before we didn't have it at all, and you just lost all your vision. So at least it's something that, retards it.
So what is dry versus wet macular
So
degeneration?
dry versus wet is simply what it says. Dry is where you are not bleeding, and wet is when you're bleeding underneath the retina.
So the bleeding is caused by these new blood vessels that grow from
Right.
inflammation.
Right.
And can you lose vision from dry and wet vision?
Yes.
Or wet macular degeneration?
Yes.
Because a lot of patients say, am I wet, am I wet? It's really two different classifications. Dry macular degeneration can actually cause just as much vision loss as wet.
Yes, and I think it's the wet is because, again, they think the shot, they don't want the shot. As long as they're not wet, they're not going to get the shot, but that does not mean that their vision won't degrade more. The problem is the wet, at least there's something you can do.
Yes.
The dry, up to this point, there was really no treatment. You just degraded. It was prevention, which we're doing, but if you got to that point, there was really not much treatment. Now there's going to be treatment for the dry.
And that's really important. That's coming out in the fall. The drug
Yep.
is already FDA approved. We're
Yep.
just waiting on some classifications from insurance and things like that. And I always like to say there's different flavors of eye doctors. Yes. And the flavor of eye doctor that does the shots is a retina specialist.
Yep.
And they are the ones that do the shots. And we work with a lot of great retina specialists
Yep.
in the area, Dr. Kleiner being one of them. And he's done a really nice job of being taking care of our patients.
It's a reflection on us. So we can send you anywhere. We can send you to any cataract surgery. We can send you to any retina. The reason we pick these guys, we screen, we do the work for you. You know, everybody said, well, who do you think is good? Well, we know who's good. Yeah. We're behind the scenes. We know who's good. And we make sure our patients get to those proper doctors.
Yeah. And so when you get wet macular degeneration, we diagnose it with the OCT, with the fundus photo,
Yep.
and we have a lot of those tools. So we can diagnose that here to see if you need those retina referrals, and then we know who to set you up with to get the appropriate treatment. And you know, the studies, again, it's all about early detection. You
Yep.
know, if you can get in for a yearly eye exam and make that a priority, then we can find it sooner, get you treated sooner, and have a better outcome.
Absolutely. And and here's the thing, not every eye doctor has that technology. We're blessed with a very high volume practice, and we have a big practice, so you have to have a volume of patients to be able to afford this technology, because unfortunately insurances nowadays just don't reimburse like they used to, and a lot of doctors don't buy that technology because they can't really afford the monthly payment on it. You have to have a lot of patients in that volume, and it's like anything else. The more patients you have, the better you get. The better you get, the more patients you have. So technology is, if your eye doctors, you're not seeing these photos, you're not seeing these machines, you're not seeing these ultrasounds, you know, God bless them, but you know, you might want to think about, you know, getting some other opinions.
Okay, good. So the OCT machine is here at Fab Eye Care. We routinely use it for patients who are at high risk for macular degeneration, and we can rule out the dry versus wet macular degeneration. All right, so that just about does it for the Fab Eye Care show. Thanks for everyone for joining us. We are so glad to have you. We'll be coming to you throughout the year 2023, and we'll have some exciting news and some different guests on the show.
And thrilled to educate. We want to educate.
Yes,
That's
so Dr.
really
Fab
is
will
the fun
definitely
part.
be a popular guest. We also have my twin brother, Dr. Josh Fabriziani, who just started last year as part of our group, and then Dr. Lewis will definitely make some appearances on this show.
We'll grab all kind of doctors. Yeah. We'll grab different people, so you get different information, and more so than anything, that you become a patient advocate. You learn about what kind of care you should be getting and what kind of exam you want to get.
Okay, thank you, and have a great day, guys.
See you guys.